October is Breast Cancer Awareness Month. A few years ago, doctors only had 4 chemotherapy drugs to treat breast cancer. Because the drugs were strong enough to fight the cancer, they also punished women with severe side effects. But as Rod Starnes tells us in our cover story, new treatments can target specific cancers while reducing side effects.
Melissa Martin had her life changed the way many women do, by finding a lump in her breast. That was in April 2008. Within days of a biopsy, she got the bad news that sent her reeling.
A lot of emotions. I think that was on a Friday that I received the news. And I think from Friday to Sunday, I pretty much had a pity party. But Sunday, I just woke up and I told myself that I'm going to arm myself with as much knowledge and information that I need to make it through this. And that's exactly what I did.
Martin went through a double mastectomy and then endured 3 months of chemotherapy.
It was hard. I lost my hair, and that was probably one of the most devastating things for me because I've always had long, beautiful blonde hair. But I got through it.
So Melissa got into the habit of wearing wigs when she went out. But the cancer wasn't through with her.
It probably was a year later that I received more devastating news that it had metastasized to my lungs. When you hear that, I think that was more shocking than hearing that the initial, that I have breast cancer. Because with metastatic cancer, you always think that you're going to die. But now treatments come so far along that women are living longer with the technology and the new drugs that are out there. And my doctor is always so optimistic and upbeat that, I know that I'm going to get the best treatment there from him, and he's going to help me beat this.
Martin's doctor got her enrolled in a clinical trial in the summer of 2009. Unfortunately, by early 2010, a scan showed her cancer was growing again. Her doctor, medical oncologist Kurt Tower of the West Clinic, got her into another medical trial, this time with more success.
And now she's back in remission again, and she's currently off therapy, recovering her strength from the treatment she had and everything. And so hers is really a very good study of women that have metastatic breast cancer. It's a series of treatments trying to induce remissions, living with those remissions, knowing that recurrence is possible, but knowing that if recurrence does happen, we have something that we can give to try to get them back into remission.
Dr. Tower says that new treatments are letting doctors move away from a one-size-fits-all approach to cancer treatments. They can now test some tumors before treatment begins. That lets doctors target cancers with the medicines that they believe will be most effective. Martin completed her last round of chemotherapy in August. She credits family, friends, her employer, the people at West Clinic, and her tremendous faith in God for helping her get back to being cancer-free. For Smart Medicine, I'm Rod Starnes.